IBS has become one of the most cumbersome things for gastros to treat. They don't have an answer for it. I mean, it's called, I don't know what's wrong with you, I'm sorry.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast. We are continuing our gut health series. A special topic that we're bringing you today has to do with immunity and infection. For this episode, just like the rest of the series, we have Dr. Michelle Retz as our guest speaker. Dr. Retz is a physician here at Ethos Integrative Medicine, and she's also the head of Gastroenterology at SCNM. So Dr. Retz, welcome back to the show.
Thanks so much for having me.
What we're really getting into with immunity and infection for this particular episode, this is kind of the crux of the build-up to everything that we've talked about in the past. Let's talk about what we mean when we're talking about our own immunity and then also the common infections, I guess, that people can experience with gut health. Can you kind of give us a little synopsis of what we mean by immunity and infection?
It is the culmination of all the lectures that we've done so far. All the different topics we've talked about are things that can compromise our immunity. We know about 75 to 80% of our immune system lives in the mucus lining in our gut. We've talked about all the things that can affect how strong or how weak those barriers are. And that really is the wall and the determining factor for whether foods are friend or foe, toxins are friend or foe, bugs are friend or foe, and they really are our guiding force. So things that compromise our ability to digest food, acid production that kills viruses, bacteria, parasites that come in our food, bugs that can hide in yeast and our ability to kill them, that also, on our army's ability to see that, those all affect our ability to determine is infection present or not. Having low forces obviously sets us up for the potential that someone can sneak right into the barrier and set up shop down the street. If we're in a stressful state, we talked about cortisol just depleting that protective mucus lining where our entire immune system lives. That really weakens us and sets us up for food sensitivities and infections. If we've had certain medications that act as toxins, but particularly antibiotics definitely can affect yeast growth and kill our own good flora and our immunity. So that also sets us up for other issues. If we've looked at anything that affects motility and transit time, how fast food is moving through or how slow it's moving through and getting to feed all the neighbors, they can overgrow and start to make toxins and cause issues. So literally everything we've talked about up to this point can play a role in the susceptibility of a weak immune system and our potential for infection.
When we're looking at infections and some of the common ones that people have, in this podcast series, we've talked about H. pylori, we've talked about Candida, we've talked about SIBO. Let's dive a little bit more into each one. If you can tell us what's going on in each particular one, what are some of the symptoms, and then we'll get into testing and all that other stuff later.
Sure. H. pylori is a little bacteria that sets up shop in the stomach, and he's associated with gastritis, which really just means inflammation and redness of the stomach or the esophagus, and ulcers. Now it's been found out in many studies he's associated with stomach cancer. The stomach has its own flora. We didn't even think bacteria lived in the stomach. There's a whole world in there. And now we're seeing when H. pylori is present, he shifts toward a lack of diversity. And when one type of bacteria starts to overgrow, it causes a lot of inflammation and makes us way more susceptible to stomach cancer. He's brilliant in the sense that he can actually hide inside yeast, and they're temperature, pH, heat resistant, freaking brilliant, right? And so he can come in on yeast, and if we're on an acid blocker, or we don't make enough stomach acid on our own, gets in, sets up shop. Yeast goes downtown to the small intestine. He's like, I'm cool, I'm staying here. And he really is cool in the sense that he makes this enzyme called urease, which neutralizes all our stomach acid. So we can't kill him with our stomach acid. Again, brilliant.
Yeah.
So he gets to nestle down in the lining. He makes this barrier, of bicarbonate and protects himself. And the real issue, the ulcer, the inflammation, and the pain comes from our immune system trying to attack him with all these free radicals. We're actually creating the damage to the stomach in our attempts to kill this guy.
Yeah.
And so it's actually our own good deeds that are causing the pain and the problems. H. pylori You may or may not have been tested for it. There's different ways to test, and not all of them are equal.
Right.
There's a blood test, a stool test, and a breath test. The blood test is crap. Never do it. If you've had it done, you can't rely on it. It's not sensitive for the bug. It's not specific for it. And if it's alive, we can't always trust the titers that we see in the blood. So that one's out totally.
Okay.
The stool test is next. It's okay. We're not able to do breath testing in kids under 11. It's not reliable results. So in kids under 11, we do need to do the stool test. For adults, though, the stool test may or may not have a positive indication. And in patients that I've had who have had a negative stool test, I can't be sure it's not in the stomach because we're checking the stool like 20 miles down. Can I rely on a piece of bacteria to be in that stool that came all the way from the stomach? And how good do I feel trusting those results? Not great. We do a breath test. So we can do a urease breath test where we actually give, a drink that only the bug can ferment to gas. And we measure how much gas is present in that patient's breath. And we can tell it can only be digested by the bug. So if the gas is high, the bug is there. We know we need to treat it. If it's not high, the bug is not there. We can feel good about that. Okay. The only other way that gastros will test for it is if they do an endoscopy, a scope down into the esophagus to look at the lining and the stomach and the duodenum. They can take a biopsy of, any inflamed tissue, and they should, and they can see the bacteria there. So they can actually test for it that way. So you can trust, definitely, if you had the breath test or a biopsy, you can be sure on your results. If you had a stool test, may or may not be sure, depending on whether you responded to treatment or not.
Okay. Even with the breath test and biopsy, is there a preference between, obviously breath test is less invasive.
Absolutely. So yeah, you can feel good about, and naturopaths can run the breath test. Yeah. My students, they think a gastro should only be able to run the breath test. No, you can get it done at SonoraQuest LabCorp, no problem. You probably could order it yourself because now they have those cash pay. If you suspected, if you don't have a physician, you could still have the breath test done.
Yeah.
And you can do it either at your naturopath's office, or you can go into the lab and actually have it done there. So whatever COVID situation you're comfortable with, you can have that appropriately done.
Yeah, perfect. H. pylori, more of an infection of the stomach. Let's go into...
Well, real quick.
Oh, yeah,
there are treatments, so it is a bacteria, and so you do need to kill it. It has got to be killed. Typically, and it's kind of brutal, the traditional allopathic route requires 2 antibiotics and an acid blocker. That's what they'll use. That's standard. They're not over-treating you. They're so resistant to so many antibiotics, they have to use 2, and they have to use an acid blocker. So that's the standard line. If you've had a lot of antibiotics, you don't do well, you have a lot of allergies, you do have options to treat naturally. There are really good natural antimicrobials that work very well and very specifically for H. pylori.
Nice.
The treatment time will be a little bit different. Usually we're treating for 7 to 10 days with an antibiotic, whereas this will probably be for a month.
Okay.
So just know the cost may be a little bit different because you might have a copay for a couple antibiotics. You will probably have 2 natural antimicrobials and a couple things to help heal the lining because you're likely going to have an ulcer or significant heartburn or pain. So we need something to heal as well as kill, but they work very well. And then we always retest. Whether you're treated with a gastro and antibiotics or a naturopathic approach, you do need to make sure you killed it because there is a risk for stomach cancer. Okay. So don't just trust that you feel better. I'm glad you feel better, but we want to make sure if you had a biopsy, you can repeat with a breath test and feel good that you've, if it says negative, that it's negative and you're good.
Makes sense. With as aggressive and good as this bug is at like hiding and really evading everything, is the recovery time from when you treat, like once it's killed after the 7 days of its antibiotic or 30 days of its natural, is it gone completely? Like we don't have to worry about all your symptoms are improving at that point?
Yeah. If there's been an extensive ulcer, traditional docs aren't really giving anything to heal the lining. So I think folks can still have some discomfort. They're going to feel better because the bug's not there.
Right.
Naturally, inflammation will be decreased. That's where we really shine is because we're really treating, healing the lining, healing up the ulcer very quickly. I can, while I'm waiting, if I'm really suspicious, I start people on things that heal the lining. And if I think there's an ulcer, healing it right away. And they'll feel that right away while we're determining, is there an actual infection present? Because you can stress yourself into an ulcer. You might not have it, but if you do and it's gone, it's gone. Yeah.
Okay. Let's jump over to the next thing of Candida. This is one that I think a lot of people, especially if they're more familiar with maybe natural medicine or more holistic medicine, different things like that, or integrative medicine for that matter. This is one that gets brought up quite a bit. I've had a lot of people come into my office saying, I think I have Candida based on these symptoms. So let's talk about what is it does it look like, and how do we test? for it?
There is a wide knowledge between men and women. I think there's a huge presence on the internet about it. Candida is a name of a type of yeast. There are many different species. Candida albicans is the most common one we're talking about. He should be in the gut in small amounts. So it's never an infection. It's more like an opportunistic overgrowth, usually. Mm-hmm. Fascinating little guy that has so many far-reaching symptoms. It's amazing between men and women. Very, very common. I think most misunderstood, at least what I see from a traditional medical perspective, is a patient will go into their PCP or their gastro and say, I have systemic yeast overgrowth. And they're like, no, you don't. You would be dead. They take the term as a yeast issue to mean that it's in their bloodstream, like it's a sepsis or something. Right, and it's like, you would be dead if you had yeast in your blood. Of course you don't. And the patient doesn't mean that, but they don't know the right terminology to use to say, I think I have a yeast infection somewhere in my gut or in my toe or somewhere, and I need treatment for that. Mm-hmm. And they're just dismissed and frustrated because they couldn't even align conversationally with the terminology. And that's really frustrating.
Yeah,
so they come to me and they're like, I think I have yeast. I'm like, you absolutely have yeast. And they're like, oh my God, she agrees. Like, that's just a validating moment. That's like, you're not crazy. You're not septic. Of course you're not. But yes, you likely do have this issue. And here's what I see playing into that. So there's a whole host of issues. But yeast is present in the gut in small amounts. Mm-hmm. We get into trouble and get overgrowth from a couple of common factors. One is antibiotics. So if you've had a lot of rounds of antibiotics, it kills all your good flora. They only kill bacteria. They don't kill yeast. So it leaves the yeast there to overgrow. Yeah. They just get to take over. They're like, woohoo, everybody's gone, party. And they just move up and down the gut and they make toxins, and those cause all kinds of symptoms. So just having a weakened immune system from all the things that we talked about, but particularly having a lot of rounds of antibiotics, you'll see women particularly will get vaginal yeast infections after a round of antibiotics. Babies will get thrush or a bright red rash on their tush after they've had a round of antibiotics. Or if mom was breastfeeding while she was on antibiotics, the baby can actually get the yeast issue or these bright red rashes under the breasts, in the groin, under the folds of the tush. They like to live in warm, wet, moist places. And there are plenty of those here in Arizona in the summer. We're all warm, wet, moist, right? Kind of gross. So that's really common if you've had the antibiotics. But lots of folks are very healthy, especially in our community, don't want to take antibiotics. And we've got even your patient populations, athletes, who are very, very careful about what they're eating. The other way we get it is eating a lot of the foods that they love. That would look like bread, potatoes, which is really just a starch inside, not really sweet potatoes or yams, but white potatoes. Bread has yeast in it. Having too much fruit. That's where I see a lot of very healthy folks and athletes getting into yeast issues is just more from the fruit component. For natural sugar, sugar is their favorite food. Sugar, alcohol, and vinegar are probably like their top three, as well as bread. So fruit, 3 or more servings a day just can really get folks into trouble. Having vinegar, fermented foods. While fermented foods usually are great for us, they increase our probiotics. We use yeast to ferment, right? So anything fermented that we take in stimulates their fermentation process and kicks them up a little bit. So kombucha and kimchi and all these other good things that you're doing, not when you have yeast. They're not okay when you have yeast. Vinegar, they freaking love vinegar. It's their favorite thing. Apple cider vinegar, which is good for digestion. We've talked about it for increasing acid and enzymes. Not okay when you have a yeast issue. It will make you feel worse. So if you tried that to improve your digestive process and you actually felt worse, it could indicate a yeast issue. You might be better off using bitters or something else to stimulate digestion rather than apple cider vinegar. Balsamic vinegar, which we love for our dressing. So people just get into a routine and have a lot of vinegar. They're cooking with it or they're using it in their salads. That also can make them feel worse. Cheese, the lactose sugar in cheese. It's not a dairy sensitivity. And milk and yogurt don't seem to bother yeast, but the cheese can kick it up.
Okay.
Peanuts and pistachios. Yeah. Peanuts have aflatoxin, can have aflatoxin, which can increase their growth. And pistachios just seem to enhance their growth as well. So avoid like peanut butter and pistachios, and then use almond butter, cashew, soy nut butter, or sunflower seed butter. Those are fine and won't kick up any issues. Antibiotics, obviously. Alcohol, because we use yeast in the fermentation process. So beer, straight up, just has a lot of yeast in it. But wine, liquor, there isn't an alcohol that we could be immune from when we have, sadly, a yeast. I know. And that's a really hard one, your glass of wine at night. But if you're noticing it's making your gut feel a lot worse, even if you're not having beer per se, it could be a yeast issue. Those are probably the most common things. And then sweet treats, sugar, actual sugar. Yeah. So all the sweet treats, that also really tends to cause their growth.
Okay. When we're looking at testing for it, this is something that we can use a stool test for, correct?
Yeah.
And this is something that I know you love talking about. So let's go into what some of this looks like.
Yeah, there's many ways to assess for yeast. So, a stool test, if I just suspect yeast, I probably won't recommend just the stool test for that because it is a pricier test. And I want to make sure I'm doing right by my patient. Is that the most practical thing I can use to get the information I need? So I have a really good questionnaire that I can use to ascertain what the likelihood is that yeast is present if we're not able to do a food sensitivity test or a stool test, or that's not indicated. So definitely the food sensitivity test we spoke of on the last podcast does check for Baker's and brewer's yeast. If you show up moderately to severely sensitive to Baker's or brewer's yeast, it means your immune system is reacting to a protein in either bread or breaded products or beer because it's cross-reacting to the yeast in your gut. It automatically is associated with a yeast overgrowth. You have to question what's the intensity of that by the patient that you're looking at. You can ascertain it there. I will say, though, in patients that I've seen, we've done food sensitivity testing and stool testing, you can see it come up in the stool, and sometimes that doesn't show up on the food sensitivity test. So it behooves us to have really good knowledge as physicians as to what the symptoms are for yeast, to be looking for that and delineating, do I think just because it's negative here, do I think it's present or not? And yes, then my favorite test, which is the stool test, which is this amazing test I'll tell you all about. But it does check for yeast, and it checks for it in each stool sample. It tries to culture it out and grow it, as well as look for it under the microscope. So we can feel assured if it's there, we'll find it.
Awesome. When we're looking at treatments for Candida, the Candida diet's often one thing that's used. This is, I know, a diet that a lot of people aren't happy when they had to go on. Can you talk a little bit about what that diet looks like, other things to consider during treatment, and then what's the expectation as far as how long does it take to get rid of Candida overgrowth?
And we should talk about symptoms too, because they can differ in men and women, but absolutely. When we're looking at treating yeast, there's 3 aspects you have to keep in mind. You have to starve the yeast of their favorite food. So there's a dietary piece there, which you're talking about. You have to kill them, whether it's with an antifungal medication or a natural antifungal. And then you need to replenish the good flora, which is your army, so that you're less likely to have Candida overgrow again. Where I see people grow into chronic yeast issues, or they just toe the line. If they look at chocolate the wrong way, they're like, whoosh, I have a yeast infection, or they like sniff a glass of wine, bam, their prostatitis kicks up or something like that, is where they haven't done one of those pieces. Usually they'll take the fluconazole or diflucan or nystatin from their OB-GYN or their gastro, just repeatedly use that, but they haven't really taken the probiotic and they're not really addressing feeding them. So that's where we kind of get into those chronic issues. Definitely from our standpoint, and there are Candida diets online, I find them to be missing a few things. So that's why I always, even though my patient will come in and go, I've read this and here's what I've been doing a really good Candida diet, I'll find usually a couple things that I still see some of those foods I just mentioned getting in. So I do have my own handout that I like to go over with folks. I'm trying to think of the book, William Crook's The Yeast. Oh, darn it. Anyway, it comes from his book. It's an oldie but goodie, but it's really thorough, very simple. It's a good general diet with addressing the factors that feed the yeast. So we go over that. We'll talk about different options for treating the yeast. We have fantastic antifungals naturally that often work better because patients have usually had multiple rounds of diflucan or nystatin, and sometimes the yeast. Yeah, the Yeast Connection. There it is. Yeah. Thank you. William Crook's The Yeast Connection. So that's a fantastic book with good symptoms, an easy read that you can probably check out. There's probably a PDF online that you could check out and check off your symptoms or not as to whether you think. But the questionnaire comes from that, and the diet also comes from that. So we have fantastic natural antifungals, which I tend to use because usually those bugs have seen the medications and are getting a little resistant, especially in our chronic patients. Yeah. There's a whole host of folks can find them online. Grapefruit seed extract, oregano, garlic, there's berberines, there's lots. Some work better for certain populations than others. So I'm careful about choosing what I'm going to use to kill the yeast in a certain patient, whether they have heartburn or other issues, as well as if I can ascertain how strong the infection is. Anytime we're killing anything, that goes today for all the things we talk about, yeast, viruses, parasites, whatever it is, if there's a strong population, there's a 1% to 2% chance in most folks that they could have a Herxheimer reaction, which is where they actually release so many toxins in the beginning, the things that are causing their symptoms, they feel much worse because we're poking the bear. We got the thing that's making us feel bad, but now we're killing so much of it at once. It's actually making us really feel not well. Yeah. We have to be careful to kill the infection, but not kill the patient. So we want them to feel well. You don't need to suffer through killing anything. I have some patients, God love them, are just like, yep, I'm going to power through. That's not my style. I don't want you to power through life, right? Like in any way. I think we can do things well. We don't need to just blow through it. So there's a way to feel good and also kill the infection. So if you start to feel those die-off symptoms in the beginning, you need to be careful about either how much antifungal you're using or using something to absorb the toxins and get them out immediately and get you feeling better while you're killing the infection.
I guess just to go over the symptoms that people experience from the questionnaire, what, can you speak to what some of those are?
It asks, we're looking at how many rounds of antibiotics they've had in their life. Have they been on birth control pills? Because Candida actually has an estrogen receptor. So interestingly, it's influenced by estrogen. Right. So women who are on hormone replacement therapy, the pill, any type of Premarin, anything like that, if yeast is present and overgrowing, it will stimulate the yeast growth. And then yeast make toxins that go up to the liver, slow the liver down from processing all the toxins, including hormones. Liver is what break down our hormones. So our estrogen backs up. And then it gets to hit that receptor again on the yeast, and the yeast keeps growing. So there's a hormone piece here for women. And when we either see them change therapies or they start killing the yeast and their liver starts processing better because the toxins are going away and they're processing their estrogen, they almost can have menopausal type symptoms. Even young women can get hot flashes, night sweats, because it feels like there's less estrogen because they're finally becoming more efficient at processing their hormones. And they've just been used to having a lot of extra floating around. So it'll ask for symptoms, bloating, belching, gas. Those are all typical of things, lots of things we've talked about. Yeah. But yeast is a constipating bug. Okay. So people don't get diarrhea with yeast. So if you're having diarrhea, that's probably shouldn't be on your radar as a concern. You might have an infection, but probably not yeast. It's a very gassy bug and very constipating. So those are typical. Brain fog is huge and notable, mostly with yeast. You won't see brain fog with H. pylori. You can see it with a few other gut bugs in general, but it is classically known for yeast. Just trouble thinking, can't focus, can't remember names, used to just be able to hammer through the day, handle multitasks, and just not able to do that. Really sluggish in their mind. They can almost feel like drugged or hungover. Almost. Joint pain, you'll see fatigue for sure. It's classically known to be associated with chronic fatigue and fibromyalgia. I've seen that time and time again as a cause. So the muscle aches, the variable joints that are sore, it's just from the toxins and the yeast getting out into the body and settling in the tissues. Very classic is the rashes we talked about. Women will get them in between their breasts, underneath, in the groin, where the groin meets the legs, and under the tush. And babies will get it, right? They'll have thrush in their mouth, or you may have had thrush and you're already prone to it elsewhere, or they'll get the bright red diaper rashes. That's classic yeast. Men can have prostatitis. Chronic or acute prostatitis can commonly be associated with yeast, and I've seen that several times, as well as interstitial cystitis, which is more of a chronic inflammation of the bladder. Guys and gals can both get that. Far more commonly diagnosed in women. I've been diagnosing it more in men who have urinary symptoms. They go to the urologist. They had their prostate looked at. It was fine. All the blood work was fine. They tried an antibiotic, didn't change their symptoms. Right. And they notice that when their gut is worse, or that when their urinary symptoms are worse, their gut is worse. There's a connection. The lining of the bladder is very similar to the lining of the gut. It can get inflamed and leaky, so to speak, when toxins are present. And those toxins go everywhere. The bladder is just one of the places they can go. Yeah. So when the inflammation happens in the bladder, those cells separate. The urine gets in between the cells, and it's irritating the lining, which is what's making them feel like they have to pee all the time, or causing that burning, uncomfortable sensation. Although there's no bacteria, the tissue's red and inflamed. Really, when we start treating and healing the gut, we'll use some herbs to heal the lining and coat and soothe, but really you need to focus on the gut. It all clears up. Fascinating, right?
Yeah, it's super cool.
Those are probably the most classic. And then in women, obviously recurrent vaginal infections, yeast vaginitis. It's coming, sorry to say, out of the rectum and it's going into the vagina. That's where it's coming from, though. It doesn't live in the vagina naturally.
Yeah.
We've got lactobacillus there, but really it's an indication that your flora's off in the vagina and you've got yeast coming from the gut. So yes, you have to treat that part, but the problem I see in the recurrent issues is not treating the gut, not recognizing that. And then folks who have the toe infections or finger infections, that's a yeast issue. Those are hard to treat because there's not a lot of blood flow down at the bottom of the foot. And you do really need to treat topically as well as systemically. So yeah, there's lots of natural and good over-the-counter things that you can use to treat the nail or around the nail. But really, it's an indication if it's been there or one or more toes are involved, you need to look at the gut.
Yeah, absolutely.
And then you can prevent that from happening when you get to that level.
When you're looking at individuals who have candida, and obviously this is going to really vary, what's the expectation that you typically have for being able to kind of get rid of all of it?
If it's not a chronic issue, if it's been a couple months, they've had symptoms, I would say 2 months is usually how long we're treating for. We're using either medication or natural antifungals, probiotic, and the diet. Right? And then potentially supporting digestion depending on the person. So 2 months, I'll check in with them after about 4 weeks, see how they're doing, making sure they're not having any challenges because the diet itself can be challenging and I'm happy to help with that. And then at the end, we're looking to wean all of those foods back in. Those foods that tend to aggravate the yeast should be able to come back in the diet because yeast is present in small amounts. You should be able to have those foods and not have an issue. So we just need to, again, remove the foods that feed the guy, kill him, and then we can bring them in and should be much more tolerant. At that point, most folks are fine. There may be one food that tends to cause a little bit of symptoms here that I may say at that point, you might want to give it another month before reintroducing it. But you should be able to have the majority of those foods, the bread, the potatoes, one or two fruits a day, vinegar, alcohol in moderation, cheese, those kind of things if you're not sensitive and not have an issue.
Yeah.
The recurrent folks, the folks who have had it for 15 years, that's where it's difficult to give a timeline. And I tend to find we can easily get them under control within that 2-month window. They have to be a little bit more careful about the dietary piece. Those are the folks who is that chocolate looking at me? I'm feeling it, G. And partaking in some of those foods will definitely bother them, kick them right into a yeast issue, a urinary issue, a rash, far more easily. They tend to toe the line where we can keep their populations under control, but they're so easily just prone to overgrowth.
Yeah.
Just being careful. And then good education, I think, on the part of the doctor. And as you go through this process, learning what that looks like, how to take care of it. So you're not constantly coming in to see me, but you're aware of what to do and doing all the right things tends to keep those things at bay. And then it's just your choice. You're in your body, you're going to participate in life how you want. And you're kind of in charge at that point of what happens.
Makes sense.
Yeah.
Let's move on to SIBO. So SIBO is more small intestine infection. We've talked about this a little bit in the previous episodes. Let's recap it though. What is it? What did the symptoms look like? And then we'll kind of dive from there.
So it stands for small intestine bowel overgrowth. And this was really found to be one of the underlying causes of IBS by Dr. Mark Pimentel in the 90s. And he wrote The IBS Connection, which was huge because IBS has become one of the most cumbersome things for gastros to treat. They don't have an answer for it. I mean, it's called, I don't know what's wrong with you. I'm sorry. We'll see you in 6 months. And I don't mean that in a mean way. It literally, though, is irritable bowel. Like, what does that mean? It can have bloating, belly, gas, diarrhea, and or constipation. It can have anxiety or depression and a whole host of other symptoms. So they really started to find that there's an overgrowth, an infection, and it's really not an infection. It's an opportunistic infection of bugs that just should not be in the small intestine. It was originally thought, and this probably, really became huge 5 years ago was when SIBO started to be on everyone's map, naturopathic and even normal PCPs. It was originally thought that it was a motility issue, and it very much is, but that there was a large intestine infection or motility wasn't a one-way street, and bacteria from the large intestine were allowed to come up into the small intestine. And once they got there, they got control basically of everything we put in our mouths. So all our food, all our supplements, everything we take, they got first pass at it, and they could ferment it to gas. And that very much still is a cause. We look at all the things we talked about in the motility podcast, all of those underlying factors can be causes for SIBO. If someone's having recurrent SIBO infections, so not making enough acid or enzymes or bile, not having enough serotonin, this door between the small intestine, the ileocecal valve, and the large intestine. If it's leaky, it's supposed to be a one-way door, but sometimes they're leaky. And so it can allow things to come up from the large intestine. If you've got a source of infection, just something that's not checked, and you don't have one-way motility, you're really prone to getting SIBO infections. And that can be yeast also. We'll talk about SIFO. Remind me to talk about that.
Yeah.
Because that's not even diagnosable at this point.
Okay.
You have to interpret that. Those were the original known causes. In the last couple of years, they recognized food poisoning as another cause. So having food come in and us not being able to kill it, or you have an episode of food poisoning, you think you get over it, you actually don't. A couple of those guys stick around and they get to build a colony, but they do so in the small intestine where they're not supposed to be. Again, they get first pass at everything and they blow everything up to gas. That's how they chew through food and supplements. So there's very much everything that affects motility and our ability to kill infection is pretty much how we get to SIBO. And same thing with SIFO. If you had a yeast infection in the large intestine, it can now, we know, come into the small intestine and cause other issues as well.
Okay.
So those are kind of all the things that affect it. The antibiotics, the acid blockers, all the medications we've talked about still put us at high risk for that as well. Diabetes, even thyroid, which affects motility and affects forward motion. If you're hypothyroid, you can have slowed motility in the gut. So it can make you more prone, if your thyroid isn't managed, to SIBO infections by that motility issue. So those are probably the biggest things. We see it highly associated with IBS, but it's becoming more associated with a lot of other diseases as well.
Okay. And you said it's SIFO?
SIFO, small intestine fungal overgrowth. So now we're seeing this. So Aero Diagnostics is one of the leading labs. They were supposed to have a test come out in 2021 to check for certain gases caused by yeast that we know wouldn't come from bacteria. COVID messed all that up. So, So I have to surmise if I've seen it in a stool test for a patient, I know they have a yeast issue. If I'm diagnosing them with SIBO, I have to think about, could they also have yeast? And in many of my patients, that has been the case. Not just taking, using the antimicrobials to kill for a bacteria. You also might need to kill for yeast too, to get the symptoms under control. And we don't have a way to test for that. You just need to think about that as a practitioner or have seen it on the stool test to go, we might need to look at that.
I didn't even know that that was a thing, that even existed. So that's good to know.
And yeast are boogers. They make biofilms and they make them hardy to help them stick to the lining. So they just knock it up a notch, basically.
Yeah. With SIBO itself, so testing for it, you mentioned Aero Diagnostics being one of the tests that you use realistically. Can you speak to what the test looks like?
In the beginning with gastros, we do a breath test. There's not a stool test. There's not a blood test. There's no physical exam, and there's no really lab otherwise that could tell you that you have it. The symptom picture you really need to think about is you've got to have gas present. Large amounts of gas. There has to be some bloating, you're belching, you're passing gas. If you don't have gas with any of your GI concerns, SIBO really shouldn't be a part of your thought process. So there can be, you're easily full, you have some pain, but there has to be some gas present. And all of the other vague kind of GI, upset stomach, discomfort, changes in your bowel movements, those can all be present, but they have to have that gas picture present. So we do a breath test. In the beginning, they used to do glucose, which is a sugar we can eat as well as the bacteria can eat. Now they offer different options, the lactulose breath test, and that tends to be far better. Lactulose, we talked about looking at for leaky gut, is a sugar we cannot break down. Only bacteria can break that down. So I use that test only. It's way more sensitive and specific, and also gets way farther down in the small intestine, closer to the valve than the glucose does. So I trust it far more. I've repeated several gastros glucose tests that were normal, and when we do the lactulose test, they come up positive. So very frustrated patients who were very sure or felt very strongly that they had SIBO, and they ran a glucose test with their gastro who said, everything looks fine. I'm sorry. I don't have anything else to offer you. Came to me, we repeated the test, and it actually was positive. So they're just not doing the right test. So lactulose breath test, that test is done at home. We have you blow into a tube or a bag, give you a sugary drink to drink, and then you blow into bags or tubes every 20 minutes for 3 hours after that. So about 10 samples. So we're measuring you for 3 hours. We're checking the amounts of methane and hydrogen gas that you make, as well as hydrogen sulfide. And so we can tell whether there's a normal amount or an abnormal amount, and that will tell us which types of bacteria are in there and what we need to do to kill them.
Right.
If you have more hydrogen, that's usually associated with more diarrhea. And if you have more methane, that's usually associated with more constipation. So those tests are read differently depending on what's present.
Yeah. With SIBO itself, so you mentioned the gas. I know one of the things that in med school I was taught to pay attention to as well was if they feel better after taking antibiotics, right?
Yes.
If they have all this gas, bloating, whatever it is, or constipation, they were put on an antibiotic, they felt better for that period of time. That was that's one of the like key things that I listened to, for that piece. I know SIBO's been more on the radar, but I've also had patients, and I'm more curious to see this from your perspective, because again, I don't do gut health in my practice primarily, but I've had like 1 or 2 patients who their parents brought, so the patient was a teenager, parents brought their kid in. They had been to Mayo Clinic. They've been, the top gastros, all this other stuff. No one could figure out what was going on with his gut. He was having all these GI symptoms. Couldn't figure out what was going on with his gut health. Again, I don't do gut health, so that's why I'm curious how they ended up here. But I was doing his case, and I was like, "Oh, you have SIBO." And sure enough, we did the test, found it. But I mean, it was missed by all these other people. I'm assuming it's more on the radar, yes, but it's still not fully there, correct? I mean,
yeah, just not integrated even into gastro. A lot of gastros still aren't. If they're not keeping up with the times, they may not be as knowledgeable, or if they diagnose it, they may not be treating it appropriately, but clearly they missed it in this case. The other thing would be if they did the glucose test and that looked negative, they would have done everything they thought. They would have probably done like a stool test or a glucose test, but those usually are negative. They're missed all the time. I'm constantly repeating lactulose tests and stool tests because they're done inappropriately with good intentions, but inappropriately. And that's where we're finding what's missing.
Yeah.
Other clues that it could be SIBO. So dead on, they'll go to the dentist, they'll get the antibiotic for their procedure, or they had, another vaginal infection or something, and they noticed, holy crap, I felt so good for those couple of days. What's going on? Well, they started killing the bacteria in their small intestine. Other clues would be if you tried a probiotic or fiber, say you were constipated and you tried some fiber, and fiber actually made you feel worse. It didn't affect your stool and it caused more gas.
Yeah.
If you tried a probiotic, it didn't make you feel better. It actually made you feel worse, or the gas got worse. Because again, they get first pass at everything we take and they just ferment it to gas. Those are classic. If you're a celiac patient and you've eliminated gluten, or you have a strong gluten sensitivity and eliminating gluten did not make you feel better, there's a chance that SIBO is present.
Okay.
If you've had chronic constipation after a surgery and you're off the opioids, or you've been on opioids for a long time, there's a good chance that SIBO can be present if your stool didn't resume to normal after you got off the medication. So we're seeing that even with surgeries and medications, now we're seeing these infections crop up. So it really does behoove us and the gastros to know about that and look for that. And I just can't encourage gastros enough to use lactulose testing. Yeah, the evidence is just far better for that.
Patients who are having SIBO are experiencing gas, bloating, and then depending on the bug, constipation or diarrhea. But the symptoms can get way worse if this goes untreated. There's this progression to where, to my knowledge, the worst part you can get to is getting the blunted villi in the intestine, to where now you're not absorbing nutrients at this point. Can you speak to what that progression kind of looks like? And is that blunted villi the worst thing that happens, or does it get worse from there?
It's the same kind of with infection in general. Whenever you have anything making toxins, it's poking holes in the lining, it's damaging our lining. These just happen to be in the small intestine where 80 to 90% of our nutrients are absorbed. Yeah. So it affects us in different ways than just large intestine infections where we absorb water and a few electrolytes. This very much compromises our ability to digest our food and absorb all those nutrients. So it can look almost like a celiac picture where they're very depleted, they have multiple nutrient deficiencies and a lot of symptoms far outside the gut that we've already kind of discussed: fatigue, brain fog, pain, aches, vague symptoms, may have changes in their vision or numbness or tingling, weird rashes, things that don't make sense because it has to do with a lack of a lot of nutrients not getting in. Absolutely.
One of the things that I've seen with patients who had this for a really long time was they lost a lot of weight. Like they couldn't keep weight on. Didn't matter how much they ate. It was just like
not getting any of their calories, and they're taking all their supplements and their medications. They can go hypothyroid. They're, whatever medicine they're taking, they're probably getting a third of it at best.
Yeah.
Same thing with all their food, all their nutrients, and all their vitamins. Yeah. Treatment for SIBO is very different than anything we've kind of talked about.
Yeah.
A lot of times, if docs suspect it or they did a glucose test and it was negative, they'll say, just go on the FODMAP diet. This very specific carbohydrate diet or GAPS diet or specific carbohydrate diet. You might have heard these terms, and if you look them up, they're eliminating carbohydrates that we know tend to feed these bugs and cause them to make more gas. But that's jumping the gun. You really don't do anything until, one, you've got this bug. You have to kill it. And then you retest to make sure it's gone. You can't go on to any other steps because it's digesting everything you take in. Your medicine, your nutrients, your vitamins. Like there's no point in taking anything else because you're going to waste your money.
Right.
So you really do either need to use antibiotics or natural antimicrobials to treat it for either 2 weeks if it's antibiotics, or the natural antimicrobials probably 4 to 6 weeks, usually 4 weeks, and then retest. We have to know it's gone.
Huge.
And then we move on to specific dietary needs, being careful to avoid certain things in the beginning. I move them through phases. I do the specific carbohydrate diet, which tends to be a little bit more specific than the low FODMAP diet. That can allow some carbs that still tend to bother a lot of people. So I move them through these phases slowly and help them integrate. We do want those carbs in. We just do it at the end once we're sure the gut is healed. Yeah. There usually is an underlying motility issue. We don't even add in motility support until we're sure the bug is killed, because oftentimes probiotics make them feel worse. Fiber makes them feel worse, right? So if we add those in the beginning, usually that can aggravate. So we have to know it's gone. Then we'll start to add in things that heal the lining, all our good herbs that, coat, soothe, heal up, holes, reestablish good flora, and help things move forward. Yeah. Traditional docs will use erythromycin, an antibiotic at a low dose, which is pricey because it has to be compounded from a pharmacy. You can there's good natural motility supports, and then probiotic itself also helps. And some of the other things that support digestion, as we've talked about, also help things move forward. We'll typically do that for at least 3 months. SIBO's tricky. Yeah. Anybody who tells you, just take an antibiotic, you'll be fine. Not my experience. SIBO is a challenging thing to treat. And Dr. Mark Pimentel, and I agree because I've seen this in my practice, 30% of patients will take an antibiotic and be fine. Won't even need to do the diet, won't ever get it again, will just be fine. 30% of people will take an antibiotic and need to stay on motility support for a year. The other 30% of folks will take an antibiotic, feel fine, need that motility support, but then they're also going to need some of the dietary. That piece is going to play into their underlying picture, and those foods will tend to need to be avoided for a little bit longer amount of time. They're more susceptible to overgrowth. Either they've got something burning in the large intestine that likely wasn't addressed, or a yeast issue, or another underlying motility issue that's not being addressed that, like, if they just get those carbs in, tends to still aggravate. And 10% of folks are still going to have maybe 25% of their symptoms still persisting. And that likely is an undiagnosed motility issue. There is, for some patients, a need to go to a gastro and make sure we're not missing anything with regard to obstruction, a functional issue of like how the vagus nerve is working, how the sphincters are working, because these also affect gas and bloating and motility. When I do all that I can, I do share, hopefully we don't ever need to get to this point, but I share these percentages with people. We won't know where you are on the spectrum until we just start treating. Yeah. But for some, there is a need for an additional evaluation.
Yeah, that makes complete sense. So you talked about the timeline, not only the expectations of what that timeline is, but what they can expect as a treatment. And this is something that is obviously treatable. Otherwise, we wouldn't talk about treatment. So it is treatable. It just takes some time to get it all adjusted. Like you said, this is, out of all the things I've seen with gut health, it's probably one of the more tougher things to get addressed, but it is possible for sure. Mm-hmm. One of the things that you said that can cause individuals to get to SIBO was food poisoning. Mm-hmm. And I think this is more of a common thing that people will experience than this SIBO and candida and the other stuff that we talked about. Can you talk a little bit about food poisoning and what's typically occurring in that case? What are some things that people need to consider?
For sure. And usually it's kind of obvious. You'll have eaten a meal, and within 12 hours, usually you're going to have some discomfort and abdominal pain, but it's usually extreme nausea and vomiting and diarrhea, or both at the same time. That's going to be the hallmark of your body trying to expel some kind of toxin as fast as possible.
Yeah.
So it's amazing how fast you can get things out of your body. And it's incredibly amazing how fast you can become dehydrated as a result of that process. So you'll have fever, chills, aches. You'll feel under the weather as if something isn't right. So it's not just gut issues. There is either a bug and or it's toxins in there that you're fighting.
Yeah.
And then you have this explosive like vomiting and or diarrhea, depending on how long it was able to get through the intestine.
Right.
Hopefully, if it doesn't get too far, it'll just be a vomiting. You'll feel much better as things get out. Those are all clues.
Yeah.
In this instance, if we think you're having an infection, we never suppress the diarrhea. We never suppress the vomiting. The body in its infinite wisdom is doing what it needs to do to get things out. We need to support the body in terms of rehydrating it, replenishing electrolytes, and preventing causes of sepsis, infection, and then dehydration and electrolyte. Those are the biggest things that we worry about. So really supporting the person in terms of keeping them hydrated. You know, Pedialyte's given for kids. It's got a ton of sugar. It's not nutrient rich enough for adults. You could go to Sprouts and get something called Recharge, which is the lowest sugar electrolyte replenishment that I know of as a good drink. Gatorade is not electrolyte replenishment. It doesn't have enough of all the electrolytes, and it has a lot of, preservatives and red dye 40 and all of those things. So it doesn't count. So I would not use it. If you have diarrhea, the brat diet. So if you've heard of that, things to slow down the diarrhea, but we're never stopping the diarrhea, right? Bananas, rice, applesauce, and toast. If you're not gluten sensitive, those tend to be the most helpful for just binding and helping you feel better or not having such a terrible, intense experience. Probiotics also are really helpful in this situation, particularly Saccharomyces cerevisiae. That has several studies when it's definitely food poisoning. A probiotic in general, absolutely. But if you can get even Saccharomyces by itself, or you have one that has Saccharomyces in it, that's the most helpful. And in kids in countries where they're really prone, India, Africa, to severe episodes, that'll stop it really quick. Nice. So we're looking at, babies become dehydrated very quickly. So we have to stop that right away. And so that's definitely a probiotic that you want to use. You want to use at least 20 billion. Okay. For a probiotic, 20 to 50 would be great. And you want to take it with food. Some of them will say you don't need to. The studies show that most of the probiotic is the best chance to get down to the large intestine all the way down when you take it with food, because the pancreas will make some bicarb that'll protect it from the stomach acid and give it a better chance to go farther. So whether it's enteric-coated or not, always take it with food. Whether it needs to be refrigerated or not, studies still show probably should be refrigerated, tends to do a little bit better.
I'm going to add the Saccharomyces to the next time I travel. We went, so I don't think I told you the story. We went to Scotland one time. My favorite place I've been in the world thus far. And I was sick for like 10 days because I had horrible food poisoning there. I got it when we were on Isle of the Skye, which is like a little island off the mainland of Scotland. It was all like complete rural. I think there was one hospital on the whole island. I had access to, I was traveling, I had access to no like medical stuff. So it was like the most frustrating thing, being medically trained and not being able to do anything about it. But yeah, I'm going to add that to my pack next time.
Couple things you should take with you. Yeah, if you guys are travelers for sure. And that's not like a high yield place for food poisoning either,
No.
But you can get it anywhere. You can. Definitely 2 good homeopathic remedies for food poisoning: Arsenicum album, Arsenicum, Arsenicum album, and Veratrum album. So those are both 2 really good remedies. Try the Arsenicum first. A 200C would be good to have on hand. You can get those at Sprouts, 3 pellets under the tongue, up to 3 times a day. And if that's not helpful, switch to the Veratrum. Those are the 2 most common remedies for food poisoning. Hydrate yourself as best you can, even if it's just putting salt in your water and, having the brat diet to get little bananas for potassium. And, if you're vomiting, you're more prone to losing acid and potassium. So you become much more potassium depleted. When you're having diarrhea, you're much more prone to becoming magnesium depleted. And so, if both of those are happening, obviously both of those electrolytes need to be supported, but just knowing based on what's happening to you, how to replenish, keep some electrolytes. You could get potassium tabs. You can get electrolytes to keep on hand, have a probiotic. And then oftentimes, my patients that are like going to Asia, I'm just putting them on a good antimicrobial or antiparasitic while they're just like just going to take BioVeg while I'm on the plane. I'm like, great idea.
Yeah.
Just to help your immune system and have some of those antimicrobials already on board, because you're likely to see them if you're going to those endemic areas.
Yeah, for sure. When we're looking at food poisoning, so people, obviously people can get it. It is something that I think a lot of people just kind of wash over because it's like, okay, I had it, it went away. It doesn't put me at risk for anything else down the road. And that's not true. So let's talk about that.
The biggest thing we now know is SIBO.
Yeah.
That's the risk factor. Yes, it could set up shop in the large intestine and cause more chronic issues that we've kind of covered, for which I will do my fantastic stool test I'll tell you about in a minute.
Yeah.
But SIBO, usually the food poisoning episode would be in the last 3 months. So it's important, if your doc isn't asking, I always ask, how many times have you had food poisoning? If it was 8 years ago or 2 years ago, not likely to be linked to what you're experiencing now. If it was in the last 3 months, very possible that it could be linked to what you're experiencing now if we're looking at a SIBO picture. So important that we're asking that question. Yeah.
Anything else outside of SIBO?
My amazing stool test?
No. Okay, good. SIBO is the only thing linked to food poisoning. Perfect. So let's talk about this stool test.
I'm such a nerd. Anyway, we'll end with poop. Why not? We started with it. We might as well end with it, right?
Yeah.
Let's bring it full circle. The CDC says when you're testing for infection, you need to do a stool test on 3 different days. 1 sample on Monday, 1 sample on Tuesday, 1 sample on Wednesday. Because oftentimes what we're looking for doesn't come out in the first sample. So I usually, sadly, will see gastros running only 1 sample. I think for ease or for time's sake, just to get results back.
Okay.
And I always repeat these tests when it's done once, because usually that's where I find the issue. The test I run, so does is 3 stool samples, checks all your good flora. I look at, even if you're taking a probiotic, how is that helping you, or where are your flora in the small intestine and the large intestine? You're supposed to have lactobacillus is the main bug in the small intestine. Bifidobacter is the main bug in the large intestine. And there's a few others we want to look at. So it'll show me where your army is.
Yeah.
Then it looks at your neutral bacteria. Those that, if are in small amounts, are fine, but if they overgrow, actually can make toxins and become as problematic as a pathogen.
Okay.
So those are definite problems, which a gastros test will not check for, and it won't check for your good flora either. It'll look for pathogens, bacteria that should never be there, which is what the gastros tests look for. So the same in that instance. It'll look for yeast, both in the culture, it'll grow it out on the plate, and it'll look under the microscope for each sample, which a gastros test won't do. It'll grow it out, and well as eggs, parasites, worms, amoeba, all the other things, which is typically what a gastros test will check for as well.
Yeah.
The difference also is that if we find anything that shouldn't be there, it'll show me all the natural things that will kill it, as well as all the antimicrobials or antifungals. And it does a fantastic description on how do we get our flora imbalanced? Where did the bug that you have come from? What are both good options for treating it? But you can see exactly what it'll be resistant to and what it'll be susceptible to. It's fantastic, very eye-opening for people, really helpful for us. So, and I get so excited about this. My students think I'm hilarious, but they come shadow me, and then, they see these results and how patients proceed with it. And they're just like, wow, this is the best. I'm like, I know, it's the best test ever.
Yeah.
So if I think it's prudent to do that, that's the test that I'm using.
Okay.
Yeah.
For people that are wanting to be proactive with their health, is it something that makes sense to run? Yes or no?
I don't think so.
Yeah.
I really like to see, I'm pretty good at delineating in a history what's going on with someone. I really reserve it for when I think it needs to be done, when I can't guess, when I really need to know, when symptoms have been chronic, they're not getting better in the way that I would guess. They had a food sensitivity test. They got only so much better. And now, infections are definitely known as a cause of food sensitivities, even more so than they used to be about 5 years ago. We're finding these toxins are very causative for poking holes in the lining and allowing food sensitivities to develop. So if you've had a food sensitivity test and you avoided all the foods, healed the lining, took the probiotic and the digestive support, and are 75% better, but something is still there, you may need a stool test to elucidate what else might be going on. And then you may find that those foods that were originally foods you couldn't have, you actually may be able to have. And I've had several of those cases happen with patients, even leaky gut pictures, very, very bad. It's a moderately pricey test, but so I don't, I want to be practical for patients, but I will use it when I think it needs to be done.
Awesome. Let's round out the rest of this chat with probiotics. I'm sure people ask you, what's a good probiotic? What are the things to look for? How often should I be taking them? Like some of the common questions you get.
With probiotics, you want to look for something that addresses small intestine as well as large intestine. So lactobacillus is the main bug in the small intestine. You want to see a 50-50 ratio of lactobacillus to bifidobacter, which is the main bug in the large intestine. So a good 50-50 ratio. A good probiotic should show you how many billion of each is on the label. It shouldn't just say 10 grams, and it lists all the strains, but you can't tell how many of each strain are in it. You need to see how much lactobacillus, how much bifidobacter. You want at least 20 billion in your probiotic. So even if it's just 10 billion per cap, you could take 2 caps a day for an adult. For kids, 5 to 10 billion is appropriate. For babies, we can use small amounts and have mom also just take it, and they can get it in the breast milk, or you can put it in the bottle, or even just put it in their mouth. Yeah. So 20 billion, usually to 100 billion are safe therapeutic ranges. BSL and these other giant 450 billion probiotics tend to kick up a lot of gas and dust because you're moving out a lot of neighbors and you're moving in a bunch of new guys at once, and they get into a huge scuffle, and that means gas, and the symptoms usually get kicked up. So I tend not to give so much in the beginning, more for, say, Crohn's or ulcerative colitis or severe illness where they may be severely depleted. Will we go 50 to 100? Usually 20 to 50 is enough. And you want to take it with food, as I said, so we make sure it gets down into the large intestine. It's more protected against the stomach acid. They should tell you how many billion. A lot of them are enteric-coated. Studies still seem to show more of the bacteria stay alive if it is refrigerated, even if it says it doesn't have to be. But if you're traveling and you have one that's enteric-coated, obviously, you just do the best you can. You're not going to keep a cold pack on the way to Asia. It's going to be fine. If it's enteric-coated, some of them will probably die, but it'll probably still be very therapeutic. You don't need to be on a probiotic all the time.
Right.
The idea is that if we're treating an illness, we treat it for a certain amount of time, and then we get you off the probiotic. You should be able to establish your good flora and maintain it on your own, provided that we're treating all the causes that pull at a weakness in our immune system, and especially the mental emotional picture, right? Because that's huge.
Yeah.
So, for posterity's sake, if you want to take one once a year for a month, that's okay. But you don't need to be on one all the time.
I think we covered everything that we needed to on gut health.
I think so.
We threw a lot of information out. You got to talk about your stool test. We got to talk about looking at your poop and what all that looks like in the very first episode. Yeah, and all the things that can go wrong and best ways to go in about treating it. Dr. Retz, thank you so much for taking the time to be on this gut health series.
It's been a true pleasure and fun experience sharing it with you.
We hope that y'all enjoyed the series. This will be the wrap up. We're going to have Dr. Retz on in the future for some more topics such as cortisol, stress, different things like that, and how that can impact your health. Obviously, we talked about that in this gut health series as well, but we'll dive a little bit more into it. I think you would agree gut health is extremely important to our overall health. We've connected how it impacts so many different things within our body. Yeah, I just want to thank you for being on. Hope y'all enjoyed the series, and we'll catch y'all in the next series. Thank you.
Wanting to look youthful and age gracefully? Our team at Ethos Aesthetic Medicine love working with individuals who want natural-looking results with minimal downtime. Our Ethos Glow approach is designed to help you show up as your absolute best self by giving you brighter, more even, and youthful-looking skin. Ask our team how you can get more information on our Ethos Glow approach to achieve natural-looking results that make you shine.